I'm Sydney. Today I will be providing teaching to a preschool-aged 5-year-old little girl. This child is in need of her yearly hearing test. Since hearing is first evaluated at birth and then should be regularly checked at her well checks at ages 4, 5, 6, and 8, as well as age 10, the patient may have already completed this before in her life, but it is important to re-educate her on the importance in the procedure right before she goes to her hearing test to where she comprehends what is going to go on during this procedure. The priority learning needs of this patient is to understand that this is a non-invasive procedure, meaning that she's not going to have anything going in her ear or that nothing is going to be cut on her skin. She's not going to have anything placed inside of her, as well as how the procedure is going to be completed. Since this preschool age child has cognitive skills, I will ensure to answer any why questions that she may have. I conclude that these are priority learning needs of this patient because she needs to be educated on the hearing test to better understand how the hearing test is going to be conducted and why this is important for her health. These priority learning needs will allow the child to feel less anxious and nervous about the hearing test. To provide the teaching to the child and their family, I will utilize my good friend, Mr. Bear, as well as some teal headphones that he's going to get to wear. These headphones will be connected to a phone. I will first allow the patient to put them on herself, and then we can ask to play whatever her favorite song is to where she can hear it first, to where she can comprehend that this is what she's going to have done in the procedure room, except it's going to be with different frequencies of sounds. The child will be able to take the bear with them to their hearing test to be able to remember that she comforted Mr. Bear during his hearing test, so Mr. Bear will be able to comfort her during his hearing test. This will allow the child to connect the idea that Mr. Bear was able to complete his hearing test while she was there with him and was able to happily get it, as well as the patient will be able to do so herself. A nursing diagnosis that is relevant to this hearing test is going to be readiness for enhanced knowledge related to the hearing test itself. This patient needs to be educated right before she's going for her hearing test so that she knows what is going to happen and that she's able to understand why this procedure is needing to be done. During this demonstration of Mr. Bear and his teal headphones, the only safety risk is that the child might find the noises in the headphones too loud when the headphones are placed on her. A short-term goal is that the child will be able to comprehend that Mr. Bear was able to complete his hearing test while comfortably sitting in a chair. The patient should also understand that every time Mr. Bear hears a noise, he's going to tap his little hand on the table. This will allow the child to better understand what the nurses and doctors are looking for as the frequencies of sound continue to go through her headphones. A long-term goal for this child is that the child will understand that during a hearing test, the nurse is completing this to help evaluate her hearing, just like she did when helping Mr. Bear with his hearing test. This is important to educate on the patient to where she understands that the nurses and doctors are wanting to know what hearing level she is at, and if there is any further need to reevaluate or if there's any assistance that she may needed during her developmental as well as during her school life. The reference that I found that allowed me to find a lot of the information on a hearing test is from the official journal of the Academy of Pediatrics with the journal journal article entitled Age at Intervention for Permanent Hearing Loss and 5-Year-Old Language Outcomes. It is important to assess a child's hearing throughout their childhood because if it is not assessed, the child may have hearing deficits that can affect their speech and their cognition and ability to learn. This can impact their everyday life as well. I would first begin by introducing myself as a nurse, as Sydney, and introduce myself to the child as well as the parents to make the parents feel more comfortable in what I'm doing. I would also come in with my good friend, Mr. Bear. I would introduce Mr. Bear. I would let the child love on him, give him a hug, shake his little hands. Mr. Bear today is going to be wearing a cute little scarf. He's got a couple snowflakes on him. He's ready for winter to let the child know that Mr. Bear is just like her. He's ready for his hearing test and he's fully prepared. He's well educated and he knows that his hearing test is going to go well. I would then grab my cute little teal headphones. They are going to be connected to my phone. I would then ask the child for her to where she could hear the noises, an example of the noises that are going to be going through her headphones. If she had a favorite song she wanted to hear, like a song from Trolls or a song from Frozen, and then I would try to play that for her to where she could get an idea of what the sound is coming through the headphones, because a child at age 5 may have never wore a pair of headphones before. So that would be important. So I would let the child, kind of hold the headphones, place them on her ears, and then whenever she took them off, I would allow her to place the headphones on Mr. Bear. So they go right over his cute little ears. And then during this part, before the hearing test begins, I would allow the patient to hold on to Mr. Bear's hand. Let her know that she's comforting him and that everything's going to be okay with Mr. Bear's hearing test. I would then tell Mr. Bear that every time he heard a noise through his cute little teal headphones, that he needed to tap the desk. So as the sounds came through the headphones, Mr. Bear would just tap the desk. So I would allow the child to hold one hand, and then I would take the phone and press play on the hearing frequencies to where the child, although she can't hear it, it's still a realistic hearing test for Mr. Bear. So he's just going to be sitting comfortably in his cute little chair, and every time Mr. Bear hears a noise, he's just going to tap the desk, and tap the desk. Again, at this point, you can still allow the child to hold Mr. Bear's hand. I would allow her, if she wanted, kind of love on him a little bit more. She's more than welcome to do that. And then after the conclusion of our hearing test, I would take Mr. Bear's headphones off. And then I would allow her to see that Mr. Bear is perfectly okay. He's still got his cute little scarf on. He's still loving on her. He's still waving. He's still just hanging out with us because his hearing test went okay. After the hearing test, it would be important that after Mr. Bear's hearing test, it would be important to allow the child to hold on to Mr. Bear. Now, she's going to be able to take Mr. Bear to her hearing test. So she's going to be able to love on him and remember that she's going to see Mr. Bear and go, well, he was able to complete his hearing test very well. So if Mr. Bear can do it, I can do it. And she can love on him during hers. She can make Mr. Bear tap the desk when she hears a noise. And she's going to be able to remember that during her hearing test. After she has come back after her hearing test, she will still have Mr. Bear. Mr. Bear will remind her of her hearing test, and then the doctor will be able to read the results of her hearing test, and then we can still use Mr. Bear if she needs another hearing test or if she needs any other interventions for her hearing diagnosis. But she is more than welcome to take Mr. Bear around with her for all of her procedures. And this is how I would educate a 5-year-old preschool child about a hearing test with me and my friend Mr. Bear.